This installment of the Crucible examines the number of hospital deaths that are caused by medical errors and the impact that they have on malpractice lawsuits. And there are two studies. The first is titled Estimating Hospital Deaths Due to Medical Errors, and it was published in JAMA in 2001. The authors reviewed the medical records of patients who died in the hospital and estimated whether the deaths could have been prevented by delivering optimal care. They determined that 6% of the deaths were probably preventable. They also determined that only 0.5% of the patients who died would have lived 3 months or more in good cognitive health, even if their medical care had been optimal. They calculated that this represented 1 person per 10,000 hospital admissions. The second study is titled Preventable Deaths Due to Problems in Care in English Acute Hospitals, and it was published in the British Journal of Quality and Safety in 2012. The authors reviewed 1,000 deaths that occurred in British hospitals and determined that 5.2% of them were probably preventable. They estimated that these patients had a median life expectancy of 6 months. In 1999, the Institute of Medicine reported that 98,000 people were dying each year in American hospitals as the result of medical errors. This report received a tremendous amount of press, and over the past decade, 98,000 has become somewhat of a sacred number in the risk management community. However, what's never mentioned is that the Institute of Medicine arrived at 98,000 by assuming that 50% of hospital deaths were preventable. This was an unsupported assumption that was heavily criticized. The American College of Physicians wrote that the Institute of Medicine's methods were, and I quote, highly subjective with unknown reliability and reproducibility. Unfortunately, no one paid much attention to the American College of Physicians. People were dying and something had to be done. Now, in terms of preventing lawsuits, the Harvard practice study had already established that most lawsuits were unrelated to medical errors. So even if the 98,000 was accurate, reducing it would have little impact on the number of lawsuits because most lawsuits aren't related to medical errors. And we already knew that. But 98,000 was such a big number that it had to be causing a lot of lawsuits. How couldn't it be? So we shifted our lawsuit prevention efforts to reducing the 98,000, and we've been stuck there ever since. Now, that approach was flawed from the beginning, and these two studies obliterate what little hope it may have had. You see, the Institute of Medicine estimated that 50% of hospital deaths were preventable, but the actual number based on these two studies is 5 to 6%, and most of those people are very sick and near the end of life. Now, I don't want to sound cold-hearted here, but plaintiff lawyers don't have much interest in these types of patients. They prefer younger, otherwise healthy people to whom juries can award significant amounts of money, not people who are already terminally ill. And I'm not saying that we should all be proud of that. I'm not even a plaintiff attorney. I'm simply saying that's the way it is. As a result, completely eliminating preventable hospital deaths would have almost no effect on the number of lawsuits because the actual number of deaths is a fraction of what people are saying, and those deaths occur in a group of patients who pose minimal legal risk. 98,000 is a big number. I did the math, and it would take more than a day to count that high. And that's impressed a lot of people. But it's an inaccurate number that has almost nothing to do with lawsuits. Thanks for listening.